Have you ever been curious about what truly goes on behind the doors of nursing homes? It's wonderful to acknowledge the care and support they offer. However, it's important to understand that there is another perspective to consider. This is a topic that often goes unnoticed. Some facilities provide excellent care, but it's important to be aware that others may have underlying problems that could impact the health, safety, and well-being of their residents. And the most challenging aspect? Sometimes, families may not be aware of these issues before it becomes too late. In this video, we'll explore 6 important aspects of nursing homes that everyone should be aware of. Understanding these factors can help you make informed decisions. Addressing issues like chronic understaffing, hidden fees, mistreatment, and medical neglect is crucial for improving care and support. These are the challenges that can transform what should be a nurturing environment into a source of distress. By the end of this video, you'll feel empowered with the knowledge to identify red flags, ask the right questions, and protect yourself and your loved ones from these hidden dangers. I'd love for you to stick around until the very end. One important issue that impacts nearly every resident often goes unnoticed, and it's rarely discussed until it's too late. This is an opportunity you definitely want to take advantage of. Let's begin our journey together. First and foremost, when there is understaffing, it can result in neglect. Chronic understaffing is a significant concern in nursing homes that deserves our attention. It's important to recognize that many facilities are facing challenges with staffing, which can impact the level of care provided to residents. When staff members are stretched too thin, it's important to remember that the residents feel the impact the most. How does this actually manifest in everyday life? Are you concerned about missed meals, delayed medications, unanswered call buttons, and seniors being left in soiled clothes for extended periods? It's important to address these issues for the well-being of our loved ones. Caregivers genuinely care and are dedicated to their roles. It's simply a matter of not having enough people to help with the tasks at hand. Unfortunately, those who truly need assistance often find themselves without the support they require at critical moments. When nursing home staff are stretched thin, it can lead to even the most fundamental needs being overlooked. It's important to ensure that residents are repositioned in their beds regularly to help prevent the development of painful bed sores. It's important to recognize that individuals who need support with eating might not always receive the assistance they need, which can lead to issues like malnutrition or dehydration. Ensuring they have the right help is crucial for their well-being. In certain situations, there can be delays or omissions in administering essential medications, which may result in significant health issues. Neglecting this aspect can lead to a swift deterioration in health. For many families, the changes can occur so slowly that they may not notice what's happening until it becomes a significant issue. Consider the situation of Walter, an 82-year-old man whose family chose a facility they thought was highly rated for his care. Initially, everything appeared to be going well. As time went on, his daughter began to sense that something wasn't quite right. With each visit, it was evident that he appeared increasingly frail, and there were moments when confusion and disorientation seemed to cloud his mind. It was through her curiosity and willingness to ask questions that she uncovered the truth. There were several instances where his medications were missed due to the staff being overwhelmed with their responsibilities. He had lost weight as there wasn't anyone ensuring he had regular meals. Unfortunately, he had developed painful sores from sitting in the same position for too long. His family had faith in the facility to provide the care he needed, but unfortunately, due to understaffing, he experienced a decline in his condition. This issue can be quite challenging, and it's important to recognize the potential risks involved. Research indicates that nursing homes with lower staff-to-resident ratios tend to experience increased rates of falls, infections, and hospitalizations. This highlights the importance of adequate staffing in ensuring the well-being of residents. When there aren't enough caregivers available, residents may miss out on regular check-ins. This can lead to medical emergencies going unnoticed for an extended period, which is concerning. For seniors, each moment is truly valuable. If you or someone you care about is thinking about a nursing home, there are several steps you can take to navigate this decision thoughtfully. It's important to start by looking into staffing levels as a key priority. Inquire about the number of caregivers assigned to each resident, both during daytime hours and overnight. This information can help you understand the level of support provided. Take the time to visit at various times and pay attention to how promptly the call buttons are responded to. This will give you valuable insights. When you notice that staff appear hurried, overwhelmed, or unable to offer prompt help, it's important to recognize this as a significant concern. When a facility is understaffed, it's important to recognize that neglect can become a reality. Addressing staffing needs is crucial for ensuring everyone receives the care and attention they deserve. It's important to recognize that neglect is just one of several concerns we should be aware of. Secondly, it's important to address issues related to poor hygiene and unsanitary conditions. A nursing home should ideally be a clean and well-maintained place, creating a welcoming atmosphere for everyone. These facilities play a crucial role in ensuring the health and safety of our vulnerable residents. It's important to recognize that many nursing homes face challenges in maintaining proper hygiene, and addressing these issues is crucial to prevent serious consequences. It's important to address issues like dirty floors, unwashed linens, unpleasant odors, and even pest infestations. Taking proactive steps can lead to a much more pleasant living environment. These are a few challenges that families often realize too late. For seniors with weakened immune systems, poor sanitation can pose serious risks, making it crucial to prioritize cleanliness and safety. Infections can quickly spread in environments that are not kept clean. It's important to ensure that residents are kept in clean clothing and have their diapers changed regularly. This simple practice can significantly reduce the risk of urinary tract infections and uncomfortable skin conditions. It's important to remember that shared equipment, like wheelchairs or medical devices, can collect bacteria if they aren't sanitized correctly. Taking the time to clean these items properly can help ensure everyone's safety and well-being. It's important to remember that even a small oversight, like a caregiver forgetting to wash their hands, can have significant consequences, potentially leading to outbreaks of illnesses such as pneumonia or gastrointestinal infections. Staying mindful of these practices is crucial for everyone's health. In some serious situations, poor sanitation can result in significant health issues, including disease outbreaks, hospital visits, and even fatalities that could have been avoided. Consider the story of Eleanor, a 79-year-old woman who began her journey in a nursing home for short-term rehabilitation following a fall. Her family made regular visits and observed a lingering odor in the hallways, but the staff reassured them that it was nothing to be concerned about. In just a few weeks, Eleanor experienced a significant respiratory infection. What's the reason behind this? Ventilation systems that have been neglected for years can accumulate dirt and debris. Unfortunately, by the time the issue was identified, several residents had become unwell, and Eleanor required hospitalization. What her family believed to be a safe environment actually presented her with avoidable health risks. Sometimes, the signs of poor hygiene can be subtle and not immediately noticeable. While a facility may appear inviting during a scheduled tour, it's important to consider what goes on behind the scenes, as it can tell a different story. When you or someone you care about is thinking about a nursing home, it's important to focus on the little details. It's important to ensure that the floors and bathrooms are clean. Taking a moment to check can make a big difference in maintaining a welcoming environment. Are the hallways filled with a fresh scent? Is there a persistent smell of urine that needs to be addressed? Are residents looking tidy with clean clothes and well-brushed hair? A facility that is kept in great condition will implement thorough cleaning protocols and ensure there is sufficient staff to uphold these standards. Maintaining cleanliness goes beyond mere comfort. Health and dignity are essential aspects of our lives. It's important for residents to have a living environment that supports their well-being and keeps them safe from harm. While unsanitary conditions are certainly concerning, the next issue we will discuss is even more alarming. Unfortunately, this is a situation that occurs more frequently than we realize, and many families may remain unaware until it becomes critical. If you're enjoying this video and finding the insights helpful, I'd love for you to comment number 2 below to let me know you're with me. If you haven't subscribed yet, now is a great time to do so. Be sure to turn on the bell so you won't miss any of our upcoming videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's take the next step together. Thirdly, we need to address emotional and physical abuse. It's truly disheartening to acknowledge that some residents in nursing homes face emotional and physical mistreatment from those who are meant to provide them with care and support. While it's a difficult topic for any family to consider, it's important to acknowledge that reports of verbal insults, neglect, and abuse persist each year. Many seniors may face challenges with cognitive impairments or expressing themselves, which can lead to these incidents going unreported for an extended period of time. Emotional abuse may often be subtle, yet it can have profound effects on individuals. It involves staff members overlooking residents, communicating with them in a harsh manner, or making them feel like a burden. Picture a situation where you rely on someone for your everyday needs, yet experience impatience, frustration, or unkindness in return. With time, this type of treatment can contribute to feelings of depression, anxiety, and a profound sense of isolation. Some residents may choose to stop eating. Some individuals may pull back and find that they no longer feel the same enthusiasm for activities they once loved. In some challenging situations, individuals may feel overwhelmed and consider giving up on life. However, emotional mistreatment is just one of the important issues to consider. Many individuals may not be aware of how prevalent physical abuse is in our society. It's important to recognize that some caregivers, feeling overwhelmed by stress or frustration, may unintentionally express their feelings in ways that affect residents. Understanding this can help us find better ways to support both caregivers and those they care for. Unfortunately, some individuals exploit seniors who may struggle to advocate for themselves. This can manifest in the use of excessive force during care or, in some cases, leaving them in bed for extended periods as a form of punishment. Additionally, we need to address the concern of aggression between residents. When supervision is limited, it's important to recognize that disputes can sometimes escalate into physical altercations. This can put vulnerable seniors at risk of harm, highlighting the need for proactive measures to ensure their safety and well-being. Consider the situation of Harold, an 81-year-old gentleman who transitioned to a nursing home following a decrease in his mobility. His family observed some bruises on his arms, and when they inquired about them, the staff dismissed it as just a minor fall. As time passed, Harold started to feel more withdrawn and anxious. A visiting relative discovered the truth when they overheard a staff member speaking to him in a degrading tone. He had been treated poorly by caregivers who viewed him as a burden, rather than as an individual worthy of dignity and respect. His family had placed their trust in the facility to provide him with care, but unfortunately, he found himself living in fear instead. What are some effective ways to ensure your safety and the safety of those you care about? Staying alert is essential. When a resident starts to seem withdrawn, fearful, or hesitant to share their experiences, it's important to recognize this as a potential warning sign. It's important to pay attention to frequent, unexplainable bruises, bed sores, or sudden weight loss. These signs should always be taken seriously. Make sure to drop by at times that might catch them off guard. Abuse can frequently occur in situations where staff feel they are not being observed. When you consistently show up and ask straightforward questions, you convey a powerful message. Your loved one is not alone in this journey. Everyone has the right to feel safe and secure in an environment meant for healing and support. Abuse continues to be a significant concern within the nursing home system. While this situation is concerning, the next topic we will explore is equally significant, as it can lead to harm that extends beyond just physical or emotional impacts. Many families are encountering a financial challenge that is becoming increasingly common. Fourthly, be aware of hidden fees and the potential for financial exploitation. Many families feel confident that after selecting a nursing home and finalizing a payment plan, they have a clear understanding of what lies ahead. It's important to be aware that hidden fees, misleading contracts, and even financial exploitation can occur more frequently than one might expect. For many individuals, the initial cost of care may seem reasonable, but it can unexpectedly increase over time due to unforeseen charges. Many people find out too late that their loved one's personal funds are being misused through dishonest methods, which can leave them in a difficult situation when they need support the most. One of the most frequent financial pitfalls arises from contracts that are unclear or misleading. It's common for families to enter into agreements that appear straightforward initially, but they may later encounter unexpected charges for additional care that they believed was already covered. Services such as assisting a resident with dressing, escorting them to meals, or helping with mobility can be itemized as separate fees, which may significantly increase the monthly bill by hundreds or even thousands of dollars. Sometimes, families may find themselves surprised when they receive bills for services they never actually agreed to, often after several months have passed. However, there are additional considerations to keep in mind. It's important to be aware that some nursing homes have been found to exploit residents, particularly those with cognitive impairments who might not fully grasp their financial circumstances. It's important to be aware that some facilities may take advantage of seniors, pressuring them to hand over control of their bank accounts, pensions, or property. Staying informed can help protect against such situations. In some unfortunate situations, staff members have been found to forge signatures, modify financial documents, or exert pressure on residents to make financial choices that can lead to vulnerability and financial strain. Let's take a moment to think about Barbara, an 84-year-old woman who has spent the last 2 years in a nursing home. Her family thoughtfully planned their budget for her care, ensuring she had sufficient funds to meet her expenses. One day, her daughter observed that Barbara's savings account was nearly empty. Feeling uncertain, she asked for the financial records and found out that Barbara had been charged for services that were never provided. There were physical therapy sessions that she missed, medication refills that weren't necessary, and a series of administrative fees that lacked clear explanations. When she approached the nursing home, they assured her that everything was above board. Upon closer examination, it became evident that Barbara had been consistently overcharged for several months. What are some effective ways to safeguard yourself or a loved one against financial exploitation? To start, it's important to ask for a detailed breakdown of charges and take the time to review them thoroughly. If you notice a bill that appears to be higher than expected, it's perfectly okay to reach out and ask questions for clarification. It's important to take your time and ensure you fully understand any documents before signing them. This will help you make informed decisions. If you come across vague terms in a contract, such as additional services may apply, it's a good idea to seek clarification in writing. This will help ensure you fully understand the agreement and avoid any surprises later on. Lastly, if a resident is experiencing cognitive impairments, it's important to have a trusted family member or legal guardian keep a close eye on their finances. This can help prevent any unauthorized withdrawals or unexpected changes, ensuring their financial well-being is protected. Financial exploitation in nursing homes is a serious issue that goes beyond just the loss of money. It can also strip away security, independence, and peace of mind for residents. While this situation is concerning, the next topic we're going to address is equally important. This is a critical issue that can significantly impact lives, and unfortunately, many nursing homes do not manage it as effectively as they should. If you're enjoying this video and finding the insights helpful, I would love for you to comment number 4 below to let me know you're with me. If you haven't subscribed yet, now is a great time to do so. Be sure to turn on the bell so you can stay updated and never miss any of our videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's take the next step together. Fifthly, there is limited medical oversight. While many nursing homes promote themselves as facilities offering adequate medical supervision for residents, the actual experience can sometimes differ significantly from what families anticipate. Unfortunately, many seniors face significant delays in getting the medical attention they need. They may be prescribed medications that aren't necessary, which can lead to sedation, or their health concerns might not be addressed until it becomes critical. Without adequate medical oversight in a facility, even small health concerns can develop into serious emergencies. It's important to ensure that proper care is in place to prevent such situations. A significant challenge we face is the shortage of medical professionals available on-site. It's important to recognize that while some high-quality nursing homes offer the benefit of having doctors or skilled nurses available at all times, others may only have part-time medical staff who visit occasionally. This can leave residents without the care they need during critical moments. In the event that a resident becomes unwell or suffers from significant pain, it's important to be aware that there may be a wait for medical assistance, which could take hours or even days. For seniors living with chronic conditions such as diabetes, heart disease, or dementia, it's important to recognize that any delay can pose significant risks to their health. One important concern to consider is the frequent use of medication, especially sedatives and antipsychotic drugs. In some nursing homes, there are instances where residents may be medicated to manage their behavior instead of focusing on their true needs. It's important to recognize this practice and advocate for more personalized care approaches. In some cases, staff might resort to using strong medications to manage residents' behavior, rather than focusing on personalized care. This approach can occur even when it isn't medically required, which is something to be aware of. This practice, often known as chemical restraint, may result in serious side effects such as confusion, falls, and a noticeable decline in quality of life. Consider the situation of Gerald, a 77-year-old man who had always maintained a keen mind prior to his transition into a nursing home. In just a few months, his family observed a significant transformation. He appeared a bit groggy and confused, finding it challenging to engage in conversations he used to enjoy. He felt uneasy about his daughter reviewing his medical records and was surprised to discover that he had been prescribed strong sedatives, which he had never needed in the past. Upon speaking with the staff, she discovered that the medications were administered to help manage his restlessness instead of addressing any genuine medical issue. He had received too much medication, not to help him, but rather for the ease of the facility. When you or someone you care about is in a nursing home, it's essential to inquire about important aspects of medical oversight. Could you please let me know if there is a doctor on staff and how frequently they make visits? Thank you. Medications are prescribed based on a thorough evaluation of a patient's condition by a healthcare professional. The decision to make changes to a medication regimen is typically made by the prescribing doctor, who considers various factors such as the patient's response to the medication, side effects, and any new health developments. It's important for patients to communicate openly with their healthcare providers about their experiences with medications, as this collaboration helps ensure the best possible outcomes. If a resident falls ill, it's important to know that they can receive medical attention promptly. The response time can vary, but ensuring that they get the care they need as soon as possible is a priority. These questions can provide valuable insights into the quality of care a facility genuinely offers. Medical oversight goes beyond simply managing existing conditions. It's essential to ensure that residents get the care they need promptly, preventing small issues from escalating into serious emergencies. This issue is indeed very serious, and the last concern on our list is one that often goes unnoticed by many. This is an issue that impacts almost every resident, but often goes unspoken until the consequences are already felt. One of the most commonly overlooked issues in nursing homes is not medical neglect or financial exploitation. Loneliness and isolation can take a significant emotional toll on us. Many seniors look forward to a sense of community when they enter a nursing home, but often they find themselves spending long hours alone, with limited opportunities for meaningful interaction. As time goes on, this feeling of loneliness can develop into depression, which can have a significant impact on both mental and physical health. The most challenging aspect? It's common for families to be unaware of the signs until they notice that their loved one has started to pull away. For seniors, maintaining social connections is equally vital as receiving medical care. Research indicates that loneliness among older adults can lead to a higher risk of dementia, a weakened immune system, and may even reduce lifespan. It's important to be aware of these impacts and consider ways to foster connections and support for our loved ones. In many nursing homes, it's common for residents to find themselves spending a significant amount of time in their rooms, often just looking at the walls or watching television by themselves. It can be challenging for staff to find the time to participate in meaningful conversations, and when structured activities are available, they may not always attract the interest they deserve. The outcome? Many seniors may experience a profound sense of disconnection from the world, which can result in a decreased interest in life itself. Let's take a moment to think about Helen, an 80-year-old woman who made the significant decision to move into a nursing home following the loss of her husband. Initially, she focused on maintaining a positive outlook, eager to connect with others and keep herself engaged. As time went on, She noticed that the staff seemed to be constantly hurrying from one task to the next, and the other residents rarely engaged in conversation with one another. The social events could benefit from some fresh ideas and more opportunities for genuine interaction. Before long, Helen decided to give up on her efforts. She enjoyed her meals in solitude, often finding herself in quiet moments throughout the day. When her family came to visit, they observed that the spark in her eyes seemed to have faded. She wasn't ill, but she was experiencing pain. It's concerning that many nursing homes overlook the emotional needs of their residents. While they do a commendable job of providing food, medications, and basic care, it's important to remember the essential human need for companionship that should not be overlooked. For seniors who may not have family visiting regularly, the feeling of isolation can be quite challenging. What are some effective ways to prevent this? It's important to prioritize social engagement for yourself or a loved one in a nursing home. Connecting with others can greatly enhance well-being and happiness. Inquire about the various structured activities, group outings, and chances for residents to build meaningful friendships. It's important to support your loved one in a facility by encouraging regular phone calls, video chats, and visits from friends and family. These connections can make a significant difference in their well-being. Hiring a companion for just a few hours each week can truly transform your experience in wonderful ways. Loneliness can feel like a quiet battle, but remember, it doesn't have to be a permanent state. Nursing homes have the potential to be nurturing environments that foster care and connection, rather than spaces filled with isolation and despair. Now that we've explored these 6 challenging aspects, let's pause to reflect on our insights and consider the practical steps we can take to make more thoughtful choices for ourselves and those we care about. If you're enjoying this video and finding the insights helpful, I would love for you to comment number 6 below to let me know you're with me. If you haven't subscribed yet, now is a great time to do so. Be sure to turn on the bell so you won't miss any of our upcoming videos. Your support enables us to keep producing valuable content that informs and inspires you. Let's take the next step together. In conclusion, let's reflect on the key points we've discussed. Ray Huntsman has identified 6 important challenges faced by nursing homes, concerns that many families often discover only when it's too late. Issues like understaffing, unsanitary conditions, financial exploitation, and emotional neglect can significantly affect the lives of seniors. They truly deserve much better care and support. It's important to recognize that although some nursing homes offer outstanding care, there are others that may have significant issues that could jeopardize the safety of their residents. As caring individuals, we have the important responsibility to ask thoughtful questions, listen attentively, and support those who might struggle to voice their needs. When you or a loved one is thinking about a nursing home, it's important to go beyond the brochures and the assurances from the facility. Take the time to visit in person, engage with the staff, observe the interactions with residents, and check out reviews from other families to gather valuable insights. It's important to inquire about the medical oversight in place, the staff-to-resident ratios, and the daily engagement opportunities available. These factors can greatly influence the quality of care and overall experience. It's essential to remember that a facility's outward appearance, no matter how clean and professional it may seem, doesn't always guarantee that it provides the quality of care that seniors genuinely require. Nursing homes ought to embody dignity, care, and respect, serving as environments where individuals are valued and remembered. If today's video has prompted you to reflect on what truly occurs behind closed doors, then it has certainly fulfilled its purpose. Recognizing your situation is the essential first step toward making improved choices for yourself and those you care about. We truly appreciate you being here with us today. We are eager to hear from you. We'd love to hear from you. Please share one thing you learned today and how you intend to incorporate it into your life. Your insights can inspire others. We truly value your thoughts, so please feel free to share them with us. Your comments truly inspire and uplift us, providing the motivation we need to keep going. If you found this video enjoyable and helpful, we would greatly appreciate it if you could like, subscribe, and share it with others. Thank you for your support. Your support enables us to keep producing valuable content that informs and inspires you. We appreciate you taking the time to watch, and we can't wait to connect with you in the next video.